Jim Rowe, the Caregiver Act purposefully targets both certified nurses' aides and home care workers for the proposed $12 per hour over present wages subsidy. Can you talk about the home care worker situation?
Yeah. Well, first off, home care workers are the largest group of caregivers in America. It's well over 2 million. We need more. We need more now. We know that all over the country there are people who have the home care benefit currently who are stuck in the hospital, not because there's not a bed for them at their own home, but because there's not a worker to go home with them. And that's already a worry, but it becomes a much greater worry when President Biden proposes to add more than 800,000 new home care beneficiaries in the country. And even at 12 hours a day of need, it would take 1.68 million new home care workers to just cover them, and they're not coming. They're not coming for what's the most dangerous job in America now. They're not coming for $9.83 an hour in Alabama. They're not coming for $18 an hour, which is considered very, very good in Seattle. They aren't coming, and the scarcity we have now leads to wild inconsistency in care. It's stressful for staff. They're continually moving and having to learn new residents. They're working very, very long hours, not only to make ends meet, but because those hours are needed to care for the number of folks we do now. And it causes stress for the elderly and the disabled. They're getting a new worker. They don't know whether it's a male or a female in some cases, whether they even speak English or their native tongue. It is a question too, and you just don't know. Scarcity leads to inconsistency. So instead of connectedness that comes from having a relationship with your home care worker, we get the opposite. And then when it's not there, what you miss is not only that chance for connectedness, but you miss someone who knows the patient that they're trying to help, who knows that Mrs. Johnson's a little confused today. I wonder if she's dehydrated or could use a little cranberry juice, because I know that she'll get a urinary tract infection and end up in the ER if I don't. But if you don't know that person, they just end up in the ER. So for quality purposes, for people to have a home care worker available to them, particularly for the new beneficiaries, the wage action needs to be incredibly bold. It needs to be middle class bold. And if that means $30 an hour in Seattle or $21 an hour in Alabama, so be it. But that's what it's going to take. We need to be honest with each other about that.